The Blue Sky Bio Tissue Level Implant and Straight Octagon Abutment is an easy solution for cementing restorations. Unlike a bone-level implant, the crown margin is finished on the bevel that's on the implant itself as opposed to the abutment. A common mistake is to restore the crown on the abutment itself and not place the margin on the implant collar. Remove the cover screw from the implant. Snap the impression cap over top the implant. Inject impression material around the impression cap. Fill the tray with impression material. Insert the tray with impression material and then seat the impression to capture the dental arch. Remove the impression. Insert cover screw back into implant. Insert analog into the impression cap. Apply soft tissue replica material. Pour dental stone into the impression. Remove the stone model from the impression. Insert the driver assembly into the SYN-OCTA compatible abutment fixation screw within the abutment. Insert the abutment into the implant level analog, making sure to align the male octagon of the abutment with the female octagon of the implant level analog. Determine areas of the abutment that require reduction and mark on the abutment. Remove the abutment from the stone model and place it into an analog. Use a burr to shape the abutment to the desired shape. Reinsert the abutment into the stone model. Mark the position of the abutment so that it can be reproduced in the patient's mouth. Block out screw access hole with Teflon tape. Wax up and cast the under casting in the usual manner. Apply the ceramic in the usual manner and complete the restoration. Insert the abutment into the implant in the position marked by the technician. Use the torque ratchet to tighten to 30 Newton-centimeters. Apply cement to the crown. Block out screw access hole with Teflon tape. Place the crown into the mouth and remove any excess cement.